Well, Harrisonburg OBGYN is a friendly practice that caters to the women of our valley, whether they be young teenagers or whether they be geriatrics or whether they be pregnant women or whether they be just, women in their middle years. But we try to cater to all those women and meet their needs wherever they may be.
We all have a different perspective, and that's good. We all have different training backgrounds, which is good. So we're not kind of a homogeneous practice. We have a very broad depth and, a lot of different experience that we bring.
The providers here are unique. I think we all have something different or special to offer.
It's a really rich group with lots of strengths.
My favorite part is helping women to become more involved in their own health care and the choices that they make. And of course, the doctors have their favorite surgeries that they like to do. Danielle and I, the other nurse practitioner, we really like our teenage patients.
I get a kick out of the teenagers. I get a kick out of just kind of that life stage and, helping them through it. I really feel like I have something to offer.
And I like being able to help women feel healthy, get healthy, stay healthy.
I do like doing a little bit of everything from taking care of the pregnant ladies. Also like some more advanced laparoscopic surgery. We're offering laparoscopic hysterectomies, which is somewhat cutting edge.
I really enjoy working with infertility patients and couples that have gone through pregnancy loss. I think it's because I enjoy the doctor-patient relationship, and when you're helping a couple through those kinds of issues, there's a little bit more involved in the relationship. It's not quite as straightforward as when you take care of someone during a normal pregnancy and everything's going fine.
I like to concentrate in urinary incontinence and prolapse. So I don't have a specialty in that. But that's kind of my focus.
I guess the one thing I would say about our practice is that we are always changing, and when things are being done that aren't working for patients, we really want to hear from patients.
We're always looking at new ways to serve patients, and that's what we're looking for. Is it, one, safe for the patient? Two, does it make sense to do it in the office? And three, will it give value to the patient?
The office procedure offers a quicker in and out time. They oftentimes only have to pay an office copay as opposed to all the charges that they're going to get when they go to when they go over to the hospital. And the anesthesia is pretty quick. It's sort of like you go off for a quick nap and wake up.
They come in, they get great care from the office staff that they're already familiar with, and they get to go home quickly. So that's one thing that I see as a strength here.
Well, I think the number one thing about Harrisonburg OBGYN is that we care, and we care about you.
Someone you feel like you can tell your story to. It's really important that you feel like you have a good rapport with your provider, whether it's the doctor or the nurse practitioner, and that you feel comfortable telling them what really matters to you.
You want somebody that's going to be kind and that you can ask questions to, that's going to be compassionate, that is always going to be your advocate, and I think we would always be that here.